What's up, good people? Welcome back to my channel. Today I want to discuss about something extremely important because it's something that I have seen in many groups of people doing this, and that's called illegitimate or non-prescribed use of steroids. Steroids have a lot of side effects, but I am touching base on the ocular problem that yes, steroids can lead to blindness. I am asked this question quite a bit that I am taking steroids for my muscular growth, for bodybuilding, weightlifting, and I want to have big bicep, big tricep, and so on and so forth. And is it going to affect my eyes? My brother, yes, it can affect your vision. Drastically, it can affect your vision. So make sure you're talking to your nutritionist. Make sure you have an eye doctor. Make sure you have a family doctor. And then maybe you might be approved for the use of corticosteroids. But here, I don't approve it. Because look at this. It's an official website of United States government, NIH. That's where it says that long-term steroids of use or could the long-term corticosteroid use lead to blindness, and that's what it's discussing. That it's a case series of CSCR. In short, it's called central serous chorio retinopathy, and that's a condition in which there is a buildup of spacing. There's a spacing, and I'm going to show you the picture that yes, this condition can lead to blindness, and this condition, CSCR, happens from corticosteroids, or in short, the steroids. If you're using steroids, if you're doing excessive use of steroids, and if you are not monitoring with your doctor, with your eye doctor, your nutritionist, your primary doctor, yes, you can get it. And of course, I am never gonna prescribe it for a bodybuilding, your doctor sitting in Ethiopia or Pakistan or many countries, yeah, they might be doing it, and some people find ways to get it without prescription, but please don't do it to yourself because it can lead to blindness. And look where it says that. It's an official website of US government, and that's where it's published, and that's where it's referred here. Yeah, it can lead to a complication called CSCR. It's known to be mild with spontaneous recoveries and minimal effects on the final visual acuity, but it can turn into chronic, which is a long-term condition of the same form, CSCR, and then a complication of long-term steroid behaves differently and may cause irreversible. So if you are getting visual impairment from steroids with this condition, it can be an irreversible visual impairment. So you could turn blind and never get back your vision if you're using steroids. So please be very, very careful. I don't want you to lose your vision just because you want a big bicep or a big tricep or hamstring and so on and so forth, whichever muscle you're focusing on. But please do not do this to yourself. Let's come to the clinical picture that these chronic cases of CSCR were precipitated by long-term steroid use prescribed for post-renal transplant, immunosuppressive therapy, post-pituitary surgery, pemphigus vulgaris. So the point is, you are getting the steroid for a long-term basis for anything. You can get that. And these patients had renal issues, and that's why they had to be given. And even they got it, even though they had their doctors and everybody was taking care of them. But so the point is, you have to be careful. You are responsible for each and every single body organ of yours. So you cannot say, yeah, this thing happened to a person with a renal transplant, it can't happen to me. No. The pathophysiology behind the blindness is very obvious in this case. And if you look at condition that I am referring to is the CSCR, that's how it looks like. Normally, this thing is not lifted up. This is the back of the eye, and I'm looking at the retina in the back, in the fovea, the macular region, and this should be plain like this, okay? But it uplifted here, and this spacing, this detachment, and this is not normal. And if it stays longer because you're taking steroids for a long-term duration, then you can have a lot of problems. So if you're on steroids for anything, be it for your breathing conditions, for kidney conditions, for your tumors, for your brain surgery, and any condition like that, please make sure you are watchful of your vision, and please make sure you go to your eye doctor, you go to your primary doctor, and they are monitoring you, because your symptoms will tell you, but we have to look in the back as well. The symptomatology will be, you will have distorted, dimmed, or blurred central vision. Central vision. Okay, that's the key word. Make sure if you see the slightest change in your central vision, things are going south. You have to be careful. And a dark area in your central vision, or straight lines appearing bent and crooked or irregular, that means you're heading towards this condition, especially if you're on steroids. And objects may appear smaller or farther away than their actual distance, so your depth perception is affected. And when you look at a white object, it may appear to have a brownish tinge or appear like a duller in color. And I am not coming up with this thing from my own knowledge. I'm just presenting it to you from a very, very authentic website. It's called American Academy of Ophthalmology. They have brought this symptomatology for this condition. And so be very, very vigilant about your own health. And thank you so much. Please like and subscribe to my channel, and share the education, share the knowledge, and prevent the people from getting into the problems, because this could turn into a serious thing. Okay, if you have any questions, please ask me in the comment section. I'm more than happy to answer. Thank you so much. Have a great day. Bye bye.